Now, let me introduce the second part, the classification of the nuclear medicine devices. According to the application, it can be divided into two categories. The first one is the scintillation detector, including the liquid scintillation counter and the gamma scintillation counter. The next one is the imaging equipment. It includes the gamma camera, the SPECT, and the PET. So let's see one by one. The first category, scintillation detector. Sometimes we also can call it the counter equipment. According to the different radiation category, it can be classified into two general categories. The first is the liquid scintillation counter. We take advantage of the liquid scintillation counter to detect the beta minus emitters. And the next is the gamma scintillation counter. We use the gamma scintillation counter to detect the gamma emitters. This picture showed us the main structure of gamma scintillation counter. So the first part is the crystal. The crystal emits light photons after deposition of the energy in the crystal by ionizing the radiation. The next part is the photomultiplier tube. Photomultiplier tube, it converts light photons into electrical signals. And it also has the electrical circuits. In this part, processed and record the electrical signals. Another category of scintillation detector is liquid scintillation counter. We use it counting the resultant photon emissions. The purpose is to allow the more efficient counting due to the emitted connected of the activity with the scintillator. It is generally used for alpha and beta particles detection. So, as for the liquid scintillation counter, we use it to detect the lower energy beta emitters, such as the tritium, such as iodine 125, iodine 123, such as the phosphorus 32, and such as the carbon 14. First, the radioactive samples are dissolved or suspended in a cocktail containing a solvent. The beta particles emitted from the isotopic sample transfer the energy to the solvent molecules. Many counters have two photon multipliers connected in a coincidence circuits. The coincidence circuits assures that the linear light purple, which reads both photomultiplier tubes, are counted, where spurious purples, such as the line losses, which would only affect one of the tubes, are ignored. So the scintillation counter includes the liquid scintillation counter and the gamma scintillation counter. We use these instruments to detect the categories and radioactivity of the radionuclide. Next, we'll introduce the second category of nuclear medicine devices, the imaging equipment. According to the clinical application, it can be divided into two categories: the gamma camera, the SPECT, and the PET. So the first one, the gamma camera. The gamma camera is the first imaging instrument of nuclear medicine. Hale Oscar Anger invented the scintillation camera in 1958. This table showed us the components of the scintillation camera. Just as what we have mentioned before, the core part is detected. It includes and sodium iodide crystal. It also includes a photomultiplier tube and an analog to digital converters. This function of the part is same as in the scintillation counter. It's to convert the radioactivity energy into the electrical signal. The second part that is very special one we call the colorimeter. A colorimeter is a device that filters a stream of rays so that only those traveling parallel to a specific direction are allowed to pass through. Without a colorimeter, just as what we have shown in this photo, rays from the directions will be recorded. The resultant imaging will be blurred and indistinct as to be useless. If a colorimeter has been added, things changed. Only rays that are traveling nearly parallel to the holes will pass through them. Any others will be absorbed by the hitting the plate surface or the slide or hole. This ensured that the rays are recorded in their proper place to the plant, producing a clear image. So, this photo shows us a construction of the gamma camera. The radioactive ray undergoes by the patients that only the one that nearly parallel to the holes will pass through. Then in the iodine sodium crystal, it changed to the photons, and in the photomultiplier tube, the photons changed to the electric signals, and with the electrical circuits, we can record and export the imaging. Okay, next nuclear medicine imaging equipment is SPECT. SPECT, its full name is Single Photon Emission Computed Tomography. It uses the radiopharmaceuticals that emit a single photon. With a rotating gamma camera, SPECT mounted on a spatial gantry that allows 360-degree rotation around the patients. The imaging from SPECT is just like what we see in CT tomographic reconstruction of the body slices. So the resolution and sensitivities are increased. These photos showed us the SPECT that we commonly used in the clinical. We also can use the small animal SPECT to finish our scientific research work. So next we see as the operation of the SPECT. Just as seen in this photo, a bone SPECT scan is used to find the bone problem, such as the cancer, such as the infection or the fractures, to check joint replacement and to find a joint problem. The camera rotates around the patient, and every layer needs 15 to 20 seconds. The total scanning time usually is 15 to 20 minutes. If you use the multi-detector, it will be faster. Okay, next we'll talk about the clinical application of SPECT. The first is myocardial perfusion SPECT imaging. It has an important value in the diagnosis of the coronary heart disease. Myocardial perfusion imaging is a form of a functional cardiac imaging. It's used for the diagnosis of ischemic heart disease. The underlying principle is that under conditions of stress, diseased myocardium receives less blood flow than the normal myocardium. The SPECT imaging performed after stress reveals that the distribution of the radiopharmaceuticals and therefore the relative blood flow to the different regions of the myocardium. The diegesis is made by the comparing the spread imaging to a further set of images obtained at rest, which are normally acquired prior to the stress images. So the next part is the cerebral metabolism SPECT imaging. It has an important value in diagnosis of Alzheimer. Just as what we have seen in this photo, it decreases the metabolism in the temporal and the parietal cortex. However, SPECT is not a very efficient technology. Only 1 in every 10,000 gamma photons is detected. Its resolution is only about 1 centimeter. So we crack a joke. Sometimes the nuclear medicine was because the anti medicine. Okay, that is all for this part. Thank you.